Now we're going to talk about Chapter 12. This is your liver, gallbladder, and pancreatic diseases and disorders. This is a picture here for you of your liver, stomach, pancreas, gallbladder, and kind of how they're all connected there. Anatomy and physiology. Your liver is the largest solid organ. It plays a role in digestion, absorption, metabolism, blood clotting, manufacturing of chemicals, storage of nutrients. Your liver is a highly functional organ in your body. Your gallbladder is just under the liver and it stores bile until you need it. Your pancreas lies behind the stomach and it produces and excretes most of your intestinal enzymes. There are different signs and symptoms of problem when you have liver disease. You're going to be jaundice or yellow. Gallbladder and pancreas disease, pain is the most common symptom. Sometimes no symptoms. They're going to do ultrasounds, just like many of the other things that we do, blood tests, liver function tests. Liver disease can range from mild to those that destroy the liver and ultimately result in death. Hepatitis is inflammation of the liver. There are different kinds of hepatitis. We have A, B, C, D, and E. Viral hepatitis is the most prevalent disease in the world. A is benign and it's spread by oral fecal contact, which, as you might guess from that term, means that somebody was excreted in someone's poo and then somebody else, they don't wash their hands well and they touch something and then you ingest that. Hepatitis B is called serum hepatitis. This is spread by urine, feces, saliva, and semen. It's considered a sexually transmitted disease. Hepatitis C is spread by blood or sexual contact, usually very slow. Finally, we have treatment for hepatitis C, but 20 years ago, people died from it. Hepatitis D requires the presence of hepatitis B to replicate. And E is also spread by that oral fecal contact. And the symptoms, jaundice, that yellowing of the skin and the eyes, liver enlargement, not feeling well, they're dark colored urine and clay or light colored stools. And they want them to rest, have good nutrition, antiviral medications, and they're going to prevent it with good hygiene, special care when handling needles and bodily fluids. There's a video for you guys to watch on hepatitis. There's a picture of jaundice in the eyes, and I have seen this. You will see this in your clients some, I'm sure, depending on which population you're working with. Cirrhosis of the liver is chronic, irreversible, and degenerative. It's also known as end-stage liver disease, and it's a replacement of normal liver cells with non-functioning scar tissue. It's called a hobnail liver. It's usually caused by chronic alcoholism. They're going to have loss of appetite, nausea, indigestion, weakness, and weight loss. There are different complications from this. You can see them there. You don't need to know all of these things. You just need to know that there can be complications of cirrhosis that can be life-threatening, and eventually this is usually going to kill someone. Non-alcoholic fatty liver disease is the buildup of extra fat in the liver tissue. The cause is unknown. They may not have any symptoms, and treatment is going to be focused on preventing further damage to the liver. Liver cancer is primary and benign tumors of the liver are rare. It's usually discovered late or end stage. It's diagnosed by biopsy, and it's very poor prognosis when you're diagnosed with liver cancer. There are different diseases of the gallbladder. Coli would just be gallbladder, and itis is inflammation, so inflammation of the gallbladder. This can cause a lot of pain. People can live without their gallbladder, so usually they'll just remove it. You can get gallstones in your gallbladder or your bile ducts, and the main symptom of this is going to be right upper quadrant. So it's going to be on your right side in the upper part of your abdomen. You're going to get pain there following meals that are high in fat. And this is just another one here that shows kind of where you can get those gallstones in your gallbladder and where it's all connected. Pancreatitis is inflammation of the pancreas, commonly caused by alcoholism. They're going to have pain, vomiting. Diaphoresis is just sweating. Tachycardia is a rapid heart rate. They're going to feel sick. And it's going to be diagnosed by a blood test. And treatment's going to depend on what's causing it. Are gallstones causing it? Is there no cause at all? Idiopathic would be like they can't find a cause. Alcoholism, they're going to want them to quit drinking alcohol, although it won't cure it. Pancreatic cancer, probably one of the most lethal cancers in my opinion. It's usually an adenocarcinoma that occurs in the head of the pancreas. The cause is unknown, but carcinogens include cigarette smoking, high coffee consumption, chemical exposure, and consumption of a high-fat diet. They're going to have loss of appetite, nausea and vomiting, abdominal pain, weakness and fatigue, and jaundice, that yellowing of the eyes and the skin. I actually had a gentleman that I went to high school with that has already passed away from this. It's going to be diagnosed by biopsy. They're going to try to do a surgical resection of the part of the pancreas that they can remove, chemotherapy, radiation, but again, the prognosis is very, very poor. And lastly, the effects of aging is increased seriousness of infections, lifestyle risks, increased biostones, decreased pancreatic enzymes. And as I said in the announcement, here there is a video that talks about the life of Patrick Swayze. And you don't have to watch it all word for word, but it really just goes into what in his life contributed to his diagnosis. And I wanted to kind of give you guys a real world example. This is something we would have watched in class, but you guys are an at-home class, so just a video for you guys to watch at home to give you a real world example of all the things that we just covered.